Hello guys, Vanakkam and welcome to Meteor Academy, one of the leading academy in training nurses in their competitive exam as well as IELTS and OET training. And we, the Meteor team, are always ahead in creating successful achiever in nursing competitive exams. Do you want to be one among them? Then follow our videos by liking it, share it, subscribe it, and don't forget to click on the bell icon. Let's begin the session. And guys, in this video we are going to learn the MCQ from community health nursing, and the topics what we are going to discuss are introduction to community health nursing as well as concept of health. So you have to observe the question very carefully and understand the rationals. The first question from the topic introduction to community health nursing is: changing concept in public health include all of the following phases except. The option given here are family and community medicine phase, social engineering phase, disease control phase, health promotional phase. This question asked in 2010 RAC MSc Nursing Entrance Exam. And here the correct answer is option A, that is family and community medicine phase. See, there are four phases in concept in public health. They are disease control phase, health promotional phase, social engineering phase, and health for all phase. The next question is complementary healthcare referred to. Options are healthcare given free of cost, alternate system of medicine, doctor and patient relationship, healthcare delivered at home. This question asked in AIIMS Bhopal Nursing Officer Exam 2018. And here the correct answer is option B, alternate system of medicine. The rationale behind this is complementary, it is also called as alternative system of medicine, in short CAM, refers to a diverse group of practices which includes Ayurveda, Yoga, Naturopathy, Unani, Siddha and Homeopathy, in short Ayush. The next question is, which of the following system of medicine is of Indian origin? The options are Homeopathy, Siddha, Unani, Acupuncture. This question asked in PGI Chandigarh Staff Nurse Exam 2016, and here the correct answer is option B. The rationale is India is known for its traditional medical system, that is Ayurveda, Siddha, Unani and Yoga. The next question is, which of the following is not an Indian system of medicine? The option given here are Unani, Feng Shui, Ayurveda and Homeopathy. This question asked in 2018 AIIMS Jodhpur Senior Nursing Officer Exam. And here the correct answer is option B, Feng Shui. According to Feng Shui, it is nothing but wind and water. YAN, in and YANG, yan. Yin represents shade, cold and inhibition, whereas Yang represents fire, light and excitement. These are all the traditional Chinese medicine, in short TCM system. The next topic what we are going to discuss is concept of health. And here the first question is, the state of complete physical, mental and social well-being and not merely absence of any disease is called as. The options given here are care, morbidity, wellness and health. This question asked two times in nursing competitive exam 2015 IGNOU BSc Post Basic Nursing Entrance Exam as well as 2018 AIIMS Bhubaneswar Staff Nurse Exam. Even though it is an easy question, many are making mistakes. So here the correct answer is option D, health. So what is health? Health is defined by WHO in 1948 as a state of complete physical, mental and social well-being and not merely an absence of disease or infirmity. Again we are going to see the similar questions related to health. Let's see it. Health is a state of complete physical, mental and social well-being and not merely the absence of disease and infirmity. This was stated by, here the options are different, that is United Nations, National Institute of Health, National League for Nursing, World Health Organization. This question asked in AIIMS Bathinda Nursing Officer Exam 2019. And here the correct answer is option D, that is World Health Organization. The next question is, which one of the following statement best describes health? The options are a relative state of being, the total state of physical and psychological wellness, the state of functioning well physically, mentally and socially, being free of sickness or infirmity. This question asked in 2016 PGI Chandigarh Staff Nurse Exam. And here the correct answer is option C, the state of functioning well physically, mentally and socially. It is a direct question. The next question is, the definition of health by WHO includes all except. The options are reproductive, mental, physical and social. This question asked in 2017 IGNOU Post Basic BSc Nursing Entrance Exam. And here the correct answer is option A, that is reproductive. The next question is, all of the following are dimensions of health except. The options are physical, spiritual, mental and environment. This question also asked in IGNOU Post Basic BSc Nursing Entrance Exam 2012. And here the correct answer is option D, environment. The rationale behind this is, health is multidimensional, as you all know. See, according to WHO definition, they predicted 3 specific dimensions, which includes physical, mental and social. Other dimensions are such as spiritual, emotional, vocational and political. The next direct question is, dimension of health that implies with the notion of perfect functioning of the body is. The option given here are physical dimension, mental dimension, social dimension, emotional dimension. This question asked in AIIMS Raipur Staff Nurse Exam 2017. And here the correct answer is option A, physical dimension. The next question is, quality and quantity of an individual interpersonal ties and extent of involvement with the community is known as. The options are mental dimension of health, physical dimension of health, social dimension of health, spiritual dimension of health. This question asked in 2018 AIIMS Bhopal Nursing Officer Exam. And it is a direct question, and here the correct answer is option C, social dimension of health. Next question, which asked in ESI Staff Nurse Exam 2019. The question is, the dimension of health concerned with proper biological functioning is called. The option given here are spiritual dimension, social dimension, mental dimension, physical dimension. Again, it is a direct question, and here the correct answer is option D, physical dimension. The next question is, all of the following are positive health behavior except. This question asked in 2014 IGNOU Post Basic BSc Nursing Entrance Exam, and the option given here are sound sleep, physical inactivity, balanced diet and meditation. Here the correct answer is option B, physical inactivity. So it is an easy question. The rationale behind this is, except physical inactivity, also called as sedentary lifestyle, all others like increased physical activity, balanced diet, meditation and reduction in tobacco, alcohol, drug, all are coming under positive health behavior. That's why we selected the option B. This question is also related to the previous one. The question is, physical activity, good nutrition, family planning, reduced stress, absence of violence, or. The option given here are lifestyle factor, physical factor, mental factor and social factor. This question asked in 2019 AIIMS Raipur Nursing Officer Exam. It is a direct question, and here the correct answer is option A, lifestyle factor. The next question is, major determinant of health. The options are public education and information, agriculture, food and nutrition, public work, water, sanitation and housing, screening for disease. This question asked in ESI Staff Nurse Exam 2019. And here the correct answer is option D, screening for disease. The rationale is, the factor which influences health are called determinant of health. They are biological determinant, behavioral, social, cultural condition, environment, socio-economic condition, health service, aging of population, gender and other factors like information, communication, food, agriculture, education and etc. These are all the things coming under what? Determinant of health. But here the major determinant of health, that is a question. Underline the word major, that's why we selected the option screening for disease. The next question is, standard of living according to WHO, which includes all except. The options are income, sanitation and nutrition, level of provision of health, human rights. Here the correct answer is option D, human rights. See, according to WHO, the standard of living includes income and occupation, standard of housing, sanitation and nutrition, level of provision of health, education, recreation and other services. That's why we selected the option D, human rights, which is not included in the standard of living. The next question is HDI stands for. Options are Health Department of India, Health Development Institute, Human Development Institute, Human Development Index. This question asked in 2017 HSSC Haryana Staff Nurse exam. And here the correct answer is option D, Human Development Index. The next direct question is values of Human Development Index range from. This question is also related to the previous one. Here the options are 0 to 1, 0 to 10, 0 to 100 and 0 to 1000. This question is asked in UPPSC UP Staff Nurse exam 2017. And here the correct answer is option A, 0 to 1. The next question is all of the following indicators are included in Physical Quality of Life Index except. Recently this question asked in the exam. The option given here are infant mortality rate, life expectancy at one age, literacy rate and per capita income. Here the correct answer is option D, per capita income. The rationale behind this is PQLI, that is Physical Quality of Life Index, is an index used to measure the quality of life and well-being of a country containing three indicators like life expectancy at 1 year of age, infant mortality rate and literacy rate. There is also a value for PQLI, that is 0 worst performance and 100 best performance. So guys, till now we discussed about two topics in community health nursing, that is introduction to community health nursing as well as concept of health. So these are all the questions asked previously in the exam. So this is like a absolute revision. So the further topics will be discussed in the future. And thank you very much for listening the video patiently. If you have any doubts anywhere, please drop your message in the chat box. And to contact Meteor Academy, the phone number, email ID, address, everything is given here. You can approach us anytime, anywhere. Thank you very much for being with us.